The University of South Carolina is making sure their medical students are trained in nutrition. It's a big talking point among health leaders right now. So today I'm joined by Dr. Phyllis McGilvery. She's the Dean of the School of Medicine, Greenville. So thank you so much for being here today.
Great to be here.
So let's first talk about what is the program that you guys are incorporating. I understand it's in all 4 years of your curriculum. And, you know, we've received, comments from people across the country saying doctors aren't trained enough in nutrition, but you guys are doing that.
We are. So our school is about 13 years old, and our curriculum actually started with lifestyle medicine integrated through all 4 years. And one component of that is nutrition education. Our students receive over 100 hours of lifestyle medicine education, and 53 of those hours in the core curriculum are based in nutrition alone. We believe nutrition is powerful medicine.
So what does that look like? Let's talk about kind of what they go through, what they learn.
So one example would be in the first year when they're learning about disease-causing agents, they learn about the foods that can help reverse those things. So for instance, instead of a blood pressure medication to reduce blood pressure, they learn that beets are actually very powerful nitric oxide promoters and can actually reduce blood pressure. That's one example.
Right. So eat some beets this Thanksgiving.
That's right.
After your meal or maybe the next day to kind of compensate for everything.
Right.
So I know the students, they actually learn how to cook meals, which I think is so essential because then they could help their patients down the road.
Absolutely.
So tell me about that program.
We have a culinary medicine course where they learn from chefs from Greenville Tech. It's a collaboration between the School of Medicine Greenville and Greenville Tech, and they learn about healthy food in cooking for patients. So for instance, if they have a patient with heart disease, they may learn a heart-healthy diet that they can then share with the patients that they're cooking with. We actually invite our patients into the kitchen with our students when they're cooking.
That's awesome. Yeah, I know you sent me some pictures of those. Yeah, we have them right there. There's
Wonderful.
The culinary classes that the students get to take. So let's talk next about the root cause. So we hear so much about this. Let's find the root cause of an illness. And can you explain what that even means at this point?
Sure. So Root Cause is a student-led organization through the medical school where they go out into the community with other partners like the American Heart Association, and they teach patients about the root cause of disease. So for instance, as they are talking about things like blood pressure, they talk about the different types of foods that can increase your blood pressure and cause heart disease. One of those is sodium. As we know, the holidays are right around the corner, and sodium is actually really harmful for folks who have heart disease.
Can you also explain what lifestyle medicine is, because that's such a big part of the curriculum? I know you can get board certified in lifestyle medicine now, and that's huge. So explain a little bit about that.
I'm actually board certified in lifestyle medicine as well as family medicine.
You're an MD, medical doctor,
Absolutely.
family doctor,
right.
which is awesome as the dean. You know,
Yes.
you have that clinical experience and then the leadership experience.
Absolutely. So there's 6 pillars of lifestyle medicine, and our students learn about all 6 pillars. We already talked about nutrition. We also teach about physical activity and why that's important. We talk about substance mitigation, so tobacco, other substances, alcohol use, things like that. We talk about stress relief and how to reduce stress in their daily lives. We talk about social connection, which is a really important one, the epidemic of loneliness and how that can actually increase chronic disease burden. And then we also talk about, let's see, I think I mentioned.
Yeah, you mentioned a lot of it.
Right.
I didn't know that with chronic disease, how depression is connected to some of this. Sometimes I'm learning so much
Absolutely.
with all of this. Why was it so important to you? Because it sounds like you've had this in the curriculum for so long. Lifestyle medicine has been in the curriculum for 13 years now.
Absolutely.
Why was that important to you?
So important because traditional medical school doesn't necessarily teach the lifestyle factors that impact disease, whereas we felt like it was foundationally important for our students to learn that as they are going out into the clinics and educating patients, understanding what patients can do from a lifestyle perspective. Patients don't like taking medications for the most part. In fact, a lot of my patients will stop a medication because of a side effect or other reasons. However, if you give them true lifestyle tactics that they can use to become healthy, they typically want to do that.
Yeah, and there's some science behind it too.
Absolutely.
It's not just like, oh, eat healthier. I mean, like you said with the beets.
That's right.
There's actual science behind it. We
Absolutely.
Got to get more people on board. So thank you so much for coming in today,
Wonderful.
breaking all of that down. I think it's really interesting. I'm happy that the students are focusing on nutrition, lifestyle medicine. I think we all really want to learn more about it.
Absolutely.
So
thanks for having me.
All right.